Kojo, we have to get on to a very important conversation on childhood cancers.
Absolutely. Let's get started. All right. Dr. Francisca Boateng and Dr. Daniela Akrisisapong, both junior residents at Kolibu Teaching Hospital. They work together at the Department of Child Health, and they are also members of the Ghana Medical Association. We're so happy to have them with us this morning. Thank you for making the time.
Thank you for having us.
Excellent. All right. Now, this conversation, this one is important. All right. We've already had a very, very impactful conversation about cancer generally. All right. And you know, it's one of those diseases that wrecks families. So if even, you know, your mother or your father or some elderly member of your family or some adult in your family suffers from cancer, it can be gut-wrenching and debilitating to see them go through, you know, the stress of it. How much more your child? And that's the reason why this conversation could not have come at a better time.
Mm-hmm.
We want to understand what childhood cancers are, how they affect our kids, how to spot them, how to prevent them, how to cure them. Okay, so that's what we're going to do together today. And let's start from the beginning. Help us first of all understand what these childhood cancers are and if there are any main types that affect children.
Okay, so I would say that childhood cancers are a set of diseases that come about as a result of the body sort of going amiss, simply put. So we have building blocks in the body. The building blocks are supposed to do specific things. They're supposed to stay in specific boundaries. So you have the cells of the body or the organs of the body in their specific places. And what happens with cancer is that those cells overgrow. And then while they overgrow, they tend to exceed their boundaries. So when we're explaining to children, we essentially say the cells of their body become naughty. And then they do what they are not supposed to do. So that's essentially it with cancer. Okay. So what you expect a part of the body to do, or where you expect a part of the body to remain, these cells overgrow and then they exceed that boundary. They encroach into other cells and other parts of the body, and then they cause symptoms based on that. So that's essentially it.
Okay. And I suspect there are certain types.
Yes.
Right.
Yes. So we have different types of cancers. We have the lymphomas, which are cancers of the lymphoid tissues. These tissues are there are things in the body that helps us to fight infections. So those systems can be affected to cause the cancer known as the lymphoma. We also have the leukemias, which are the cancer of the blood cells, because we have different cells in the blood, and then either of them can be affected to cause a cancer. We also have the cancer of the eye, which is known as the retinoblastomas, cancer of the kidney, which is the nephroblastomas. We can have cancer of the brain, cancer of the muscles and then bones, and as well as cancer in any other parts of the body, but these are the most common ones that we see in children.
And all of these can afflict children?
Yes, they can.
Okay. All right. So, are there in Ghana certain types that are more common than others?
Well, I would say
in children, I mean, yeah.
Okay, so in children, the commoner types are the lymphomas, that's the cancer of the lymphoid tissue, and then the leukemias, so the cancers of the blood. Those are the ones that commonly afflict children. But you can also, all the other types that Dr. Boateng mentioned are also things that we see in children, but we commonly see the lymphomas and then the leukemias. Yes.
Okay, all right. So, if we were to take the most common ones, could you talk us through how each one manifests, what it does to the body? The main ones.
Okay, so I would say that it's important to note that wherever the cancer is, that's where you have like the manifestations. So say we're talking about cancer of the blood. There are different cells that make up the blood. Okay, so we have the red blood cells, we have the white blood cells, we have the platelets that help to. So the platelets help to clot the blood. The white blood cells help to stop infections, and then the red blood cells that make the blood itself red is what carries oxygen and then spreads it to the rest of the body. Okay. So for instance, if you had a cancer of the blood, you would have an issue with the level of your blood. So they tend to have very low blood levels because the cancerous cells are eating up the red blood cells. You could also have the child being prone to infections because obviously the white blood cells or the cells that fight infection are affected. They can't do what they're supposed to do. Then when you have the platelets that are affected, that's what helps the blood clots. Then you have children who are bleeding easily. So you have them presenting with the commonest things like gum bleeds. They're very pale, they're tired, they are unable to do what they usually could do. They may also have infections frequently, so they tend to have fevers, unexplained fevers. So you have the child has a fever this week, you take some paracetamol, nothing is happening. The next week the child has a fever, and this continues for a long time. So you've treated everything that you can think to treat with over-the-counter medications, but this child is still unwell. The child is also losing weight because obviously cancer is a very aggressive thing, so it sort of engulfs all the body cells. It tends to affect them. So this child is losing weight. If you have a cancer of the brain, then you have a problem with balance. So this child is walking usually.
Let's finish with the blood, the cancer of the blood.
Okay.
Leukemia is an example, am I right?
Yes.
Okay. Now, does leukemia affect platelets or white blood cells or red blood cells? How does leukemia work?
So the leukemia affects all the cells, all the cell lines.
Okay.
So we have, like I mentioned, so you have low blood levels. That is, you have anemia. You can have neutropenia. That is low neutrophils or low white cell counts. Then you can have the thrombocytopenia. So when we say penia, we mean loss of or little of. So that's affection of the platelets. So that's when you have the manifestations I mentioned.
Right.
So with the anemia, you are pale, you are tired because obviously your body doesn't have enough blood, enough oxygen. With the neutropenias, the low white blood cells that fight infection, you have frequent infections. And then with the thrombocytopenia, you have the tendency to bleed. So you have a cut and then you keep bleeding and bleeding. You may have dark spots, like pinkish spots that show that you're bleeding under the skin, and of course the gum bleeds.
And then you also talked about the catching of frequent infections and fevers.
So there are fevers.
Okay. All right, please continue. We're talking about the brain.
Okay, so
Yeah, so for the brain, you could have, like she mentioned, you can have, most of the time they have persistent headaches. They sometimes complain of nausea, like they feel like vomiting, and most times as well, they vomit as well. And she talked about the lack of balance and then the change in the gait as well. So probably it also depends on the age of the child. So if you will not expect to see everything in every child. So supposing a child was able to walk and the child developed the cancer of the brain, there will be regression of milestones. This child might lose the ability to walk, and then that should be something of concern, should be raise a red flag. We also have cancer of the eye, that is the retinoblastomas. Usually you see this white spot on the pupil. Sometimes too they have some growths in the corner of the eyes, and when you look at the eyes, it's like their eyes are bulging out. And then most times too there's loss of vision in either one or both of the eyes, which can sometimes lead to blindness. And then they sort of have, like when you're looking at they call them squints. When you're looking at the child's eyes are not facing one direction. It's like one eye is looking toward the other side, the other one is looking toward, those are squints. Those are also something that you should be looking out for. Then we have unusual lumps and swellings that you'd usually see at the jaw. They can happen at the head area, which is the jaw, the neck. You can see them in the abdomen, which we call the stomach. You can see them in glands like the scrotum, the testes, and all these other.
What sort of cancer causes those swellings?
Those are mainly the lymphomas.
Right.
Yes. So like we talked about, there are tissues that help to clear infections. So you know what we call the lymph nodes, they are positioned in various parts of the body, and then this is sort of helps to clear the body from infections. But like she said, if there's an abnormal growth of it, instead of it doing what it's supposed to do, it's not able to function properly. So it tends to grow bigger, and then they sort of form like a swelling or a lump in these various parts of the bodies.
Wow. Okay. So, I mean, what causes it? What is it that makes a child develop cancerous cells?
Honestly, they are not sure. We are not sure what the cause of these cancers are, but then certain factors have been linked to its development, like environmental factors. So, exposure to radiation, exposure to pesticide chemicals such as pesticides, and then certain medications. Also, some viruses such as the HIV, the hepatitis B and C, and then the Epstein-Barr virus as well. I mean, there's no real clinical, I mean, in less than 5% of these cases, we can say that they are connected to genetic predispositions. That means that something that maybe your mother, your father, your grandmother had, and then you're also having it, but it's quite rare. Yeah, it's just less than 5% of such cases. So honestly, we are not too sure what the exact cause is.
Maybe you can break down the risk factors a little bit more for us. Okay, you've talked about radiation, some chemicals like pesticides, and so forth. Can we talk about them one by one? Like with radiation, what's the risk? What are the things that can put a child at risk of, or can expose a child to radiation that will then put them at risk of cancer?
Okay, so before I say this, there's a tendency that some parents will be scared, but there are some tests that we do in the hospital that could expose a child to radiation. For instance, X-rays. So those are the common things that can cause radiation. So frequent X-rays, for instance. Usually we have CT scans. They can also expose a child to radiation. But these are things that are usually done when needed, so we don't tend to do them more often than we need to. But I mean,
Doc,
obviously,
can I just ask, when you say frequent,
like how many?
Exactly?
Yes, how frequent is
so
frequent?
I can't say. I mean, obviously, one X-ray or two X-rays are not going to affect the child, but maybe I'm thinking like a child has a condition, you probably have to constantly be checking, maybe once a month, twice a month, constantly checking their chest or a part of the body. They have to keep doing CT scans. Those are things that can expose a child to radiation. Sometimes we say high tension poles, so children that are very close to high tension electrical poles. So for instance, you're in a city and then there's a high tension pole very close to your home. Those are things that can be dangerous. So typically nobody's supposed to live around such areas. There's supposed to be like a clear space between where they live and then where the high tension poles are.
Yeah, Accra. Some people, there's a high tension pole in their living room.
Exactly.
Wow.
Exactly.
But doctor, there's an issue of what if the child needs the X-ray?
Yes.
You talk about the frequent X-rays. What if it's a need?
So in medicine, it's really weighing like the benefit. You get it. You're looking at the risk benefit analysis. So if this child really needs the X-ray, we try to do it as little as possible. So you are weighing, this is a child who has frequent chest infections because of some other condition, and you constantly have to check, or a child who has tuberculosis, you would have to still do the X-rays, but you may have to reduce it as often as you can. I mean, if you have to do it 3 times, you can afford to do it once, so that you mitigate the effects of the X-rays. Yes.
So really, what it means is you need to have conversations with your doctor about these things.
You
And
do.
they obviously know best and can help
Exactly.
you.
So it doesn't help to probably go and maybe, some people are unwell and then they just go and see someone. They say, oh, just go and do an X-ray and come. That is really not something that would be advisable. Yes.
Okay, so that's radiation. Then you talked about pesticides.
Yes. So some drugs and some chemicals, all these pesticides, these weedicides, things that we tend to use for farming, these dangerous chemicals that are used to kill weeds, that are used to exterminate insects. So these are not things that typically a child should be exposed to, or any person should be exposed to. So we even advise that the farmers wear protective equipment. So those farmers or those who work in these industries that use these chemicals, ideally they shouldn't be taken home. And when people are exposed, those who are going to be exposed to them need to wear some personal protective equipment so that it's not in direct contact with the body. But if you take it home, then you have children who tend to go and play with them. They are around in the same vicinity as those chemicals. So
Have we identified specific, chemicals that increase the risk, or
So,
is it just generally?
Yes, just generally, because we
Pesticides
don't know
and
exactly,
pesticides.
most of these things are associations. So, mind you, they are not exact causative factors. They are things that predispose the body to going its own way. Yes.
Right.
So they are not exact causative factors. So not to say that if once you are exposed to this chemical, then you're going to get cancer. There are some children who are exposed to it their whole lives. They probably would not get cancer. And then there are some children who are exposed to it and they do. So it's a host of factors and like multiple things. Yeah.
So we've talked about radiation. We've talked about chemicals. What else is there?
So Dr. Watson spoke about viruses.
Yeah, the viruses.
Yeah, let's talk about those. Which viruses?
Okay, so HIV. HIV HIV causes 1 million things, yes. And of course it's in one of these it's one of the causes of cancer. So if a child has HIV, a child who got HIV from mother to child transmission. So when the child was born, the child got it from the mother, not that the child got it by themselves. So those children have long-term effects of HIV, and this HIV can also lead to cancers. We also have the Epstein-Barr virus. So it's also a virus that causes other conditions, and it can also predispose children to having cancer. So a child could be infected with Epstein-Barr virus prior, and then later on we see that this child has come in with cancer. So maybe Dr. Boateng would like to add.
Well, that's basically about
Yeah.
it.
Okay, so virus, radiation, chemicals. Is that it?
Yes.
Okay. Now, if you've just joined us, we're talking to Dr. Daniela Akresi Sapong and her colleague, Dr. Francisca Boateng. Both of them work together at Kolebu Teaching Hospital's Department of Child Health. They're members of the Ghana Medical Association, and they're helping us understand childhood cancers, right? So you've walked us through some of the causes. You've mentioned a few of the symptoms, but I don't know if there is an extensive list of symptoms parents can look out for. If we can educate them right now, what are the things, if your child is in front of you right now, or you are thinking about how your child has been behaving, for the past few weeks or whatever, what are the things you would say as a parent they should pay attention to, because it might be a sign of childhood cancer?
So any symptom that has been persistent for a very long time, which they keep treating, either over-the-counter medications or going to the hospital, in and out of frequent visits to the hospital, but then they are not finding a solution to, I think that should raise a red flag for further investigation.
Okay, so just before you move on, a symptom that has persisted for a long time.
Yes,
Can
so-
you break the long time
Yes. So over 2 weeks. So let's say you have a fever. You've been having recurrent fevers for more than 2 weeks. You are taking anti-malarial. Some people are treating for typhoid. They are doing all sorts of things, but then the fever is just not settling. That is something that you should raise a red flag to, that needs further investigation. Or you have an unexplained weight loss. You are eating very well. You are doing everything right, but you are just losing weight. You can't understand it. You don't know what is going on. Everybody, you go to the hospital, they say everything is fine, or you can't just find a solution to what this problem is. That is something that should raise a red flag and should let you know maybe there's something going on. Or you do some fatigue. When we say fatigue, that means you easily get tired. You do something little, you are tired. Even something that doesn't mean exerting a lot of energy, you are tired. That is something that you should look out for as well. And then also, if your child is in front of you, you should look at the child's eye. We talked about that white spot in either of the pupils, or a growth or a swelling in the eye. Or you see that your child has persistent red eyes. Every time the child's eyes are red, it's a cause of concern. We talked about the bulging eyes, where it's like the eyes are popping out. One eye is bigger than the other. It's like the eyes are just about to come out of the socket. It's something that you should look out for. And then the squints as well. And you also have to always check your children's bodies for any swellings anywhere around the neck. It can be around the jaw. It can be at the jaw, it can be at the neck, it can be, you can actually touch your children's abdomens, the stomach, to see if there are any unusual things around there. We all know that the liver is at the right side, under the rib cage. Yeah, so sometimes it can get big. And then the spleen is on the left side, under the left rib cage. It can also get big. And then if you are feeling it, it's something that you should be concerned about. You can also touch the stomach. You feel some masses in the stomach which are not supposed to be there, and it's also a source of concern. You can for the older children, they would actually those that have the swellings in their testes and then the scrotums, they can complain about it, that, oh, mommy, I feel this swelling, or I think my scrotum has become bigger than it is, and it's something that needs to be investigated for. And then we also talk about the persistent headaches. The child keeps having headaches. He goes to school, he comes back, we think that it's from tired, it's from schoolwork, it's from a lot of play, but then this child keeps complaining of headaches. You keep giving analgesia, medication to bring it down, but it's just not abating. It's something that should be a cause of concern. And then maybe a child was able to do something, like we talked about the milestones. Probably a child was walking, a child was able to talk. All of a sudden, this child is not even able to get up, or the child has a slurred speech. It's talking all right, but it's not as fluent. It's slurred. You can barely hear what the child is saying, and that is something that needs to be investigated further.
Yeah. Okay. I would like to add that it's very important for parents to listen to their children. I think that in our society, that's one of the things that causes cancer to probably be diagnosed late, because a child comes in and I have a headache, and the parent thinks, just go and rest, or I can't do this, and then the parent is saying you're lazy. So it's important, if you see that your child is complaining about something persistently, to look into it. It doesn't hurt to take them to the hospital to get a quick blood check. And the funny thing is, you can actually start detecting cancer very early from just a quick full blood counts, like just the HB, and then, because those are the cells in the blood. So you look at that and you can easily tell, a doctor can easily tell, there's something wrong here, so maybe we can do further investigation. So parents, please listen to your children. They're not just lazy or just looking for an excuse not to go to school.
How about those children who cannot talk, who can't communicate?
So I say that's one of the reasons I love pediatrics. Children do not pretend. A sick child is a sick child. So when they're sick, they typically would cry, they'll stop eating. They just don't do the things that they usually do, because even at the hospital, when a child comes in and they're sick, it's easy to tell. When they're well, they just start to play. They can't help it. They're real. So if your child is usually very active and your child is all of a sudden very dull, very sullen, then you need to look into it. What is going on with this child? Maybe you're trying to offer the child food, the child isn't eating. And then obviously, Dr. Boateng mentioned the weight loss. It's also something that really pops up with cancer. Yes, I think we forgot to mention that sometimes with the bone cancers, you have bone pain, back pain. The child is unable to bear weight on that side. And then the child also has like some swelling in the limb. So you notice a difference in the limb size. And then there's also cancer of the liver, where you may have their eyes turning yellow. So that would be something that will be glaring, and then you can, look into it.
This is the Super Morning Show on Joy, and we're talking childhood cancers. Our guests this morning, Dr. Francisca Boateng and Dr. Daniela Chrissy Sapong from Korle-Bu Teaching Hospital, Department of Child Health. They're members of the Ghana Medical Association, and they're teaching us everything we need to know about childhood cancers. When we come back, we'll find out, first of all, what you can expect if you decide to investigate some anomalies in your child. You go to the hospital. What can you expect? What processes will you be taken through? What should you look out for? How do we prevent? Is there a way of preventing your child from ever, getting any of these childhood cancers? If you are unfortunate enough and your child is diagnosed with it, how can it be handled? And most importantly, when we keep talking about early detection, when we come back from this break, we will find out why it is so important to detect early. This is not to scare you, it's to prepare you. So stay with us. We'll be back after this.
Your morning radio.
getting back to our conversation on childhood cancers.
All right, so let's reconnect with Dr. Francis Boateng and Dr. Daniela Akresi Sapong. We've learned so much already, okay, but there's more, and of course we're going to have our callers bring in their questions as well. But let's first of all understand why all this talk about early detection. What's the advantage of early detection? Why is it so important for childhood cancers to be spotted early?
Okay, so the great news is that once these cancers are detected early, about 75% of them can be treated. Yes, so early detection, early access to healthcare, and then the appropriate treatment modalities can save as many as 2/3 of the children who are plagued with cancer. So once you see something that is concerning, you bring the children in, we detect it, and then we start treatment as early as possible. So that's why early detection is very important. Yeah.
Now, if you don't detect it early, you don't start treating it early, that comes with its problems, doesn't it?
It does. It does. So once the cancer is detected late, it means that it has a chance to spread even further. And at some point, when the cancer has spread throughout the body, there's very little that the medications can do. So it's best when the cancer is in one locality, you can target it there, and then possibly surgery can help remove the rest of the cancerous tissue, and then you can go on to maybe do another set of chemo to help. But once the cancer spreads, so maybe the cancer started in the bone, is gone to the brain, is gone to other parts of the body, then it's almost impossible to treat it, because then generally the organs are affected, and that's more difficult to handle. Yeah.
And could you, I like a little breakdown in terms of the early detection. So my child comes complaining about headaches. How soon should I alert the doctor that perhaps we've tried every other thing and it hasn't worked?
Okay, so like Dr. Boateng mentioned, if a child has an unexplained headache, so maybe the child comes in today, has a headache, you take paracetamol, the headache is still not going, you maybe wait 3 days, still not going, a week, still not going, then it's best to come to the hospital, because usually by then a parent would have quickly gone to the pharmacy, bought anti-malarials, a parent would have given enough paracetamol, and I mean after about 4 to 5 days, maximum a week of paracetamol, anti-malarials, headache is still there, then you definitely need to come to the hospital.
Would you say that it saves money to detect it early as well? Does it affect the cost of treatment?
It does.
It does.
It does to a large extent, because, well, once you come early, then there can be a plan. So you understand that probably, the chemotherapy goes on for a number of years, the initial one and then the continuation. So parents have a fair idea of how much they need, then they can plan ahead. They can seek help. Also, it helps the healthcare workers, if there's a need for us to assist in some way or contact some organizations, write letters, it helps to do that for them. And then also, obviously, if you have widespread disease, and for instance you have kidney failure, your liver is failing, your heart is failing, you have all these other things, then you need a lot more to handle that, because whether or not the child is early or late, we sort of have to manage the symptoms. We sort of have to ensure that the child is comfortable, the child has some good quality of life. So the later you come, the more likely you are to rush through the stuff that you would have had to do within 3 years or 2 years, and then the more likely you are to spend more, because once you are not prepared, you haven't budgeted financially, then you tend to go into a lot of your savings or a lot of the money that you didn't bargain to spend. So yes, definitely it saves a lot of money.
So in November 2021, the NHIS announced that children battling with childhood cancers are to receive groundbreaking healthcare services following the inclusion of the disease on the National Health Insurance Scheme's benefit package. And they mentioned specific cancers, the 4 childhood cancers, acute lymphoblastic leukemia, Burkitt lymphoma, retinoblastoma, and Wilms tumor. Well, you're doctors at Korle Bu. How real is this? Is the NHIS paying for, the treatment of childhood cancers?
Well,
I see some furtive smiles here. What's the situation?
I mean, very
we don't want to. We just want the reality. Look, what's the
Yeah.
situation? If there's a problem,
So-
we can help solve it. What's it?
Okay, so I would say that so far the majority of the cost is still being borne by the family and by organizations that are supporting these children with cancer. We are not seeing much of the support from the NHIS because they still have to pay for 90% or 95% of their labs, their medications. They're still doing all of that. So I don't see the full help from the National Health Insurance.
Oh, this laminated card. All right. Okay. Well, that's the reality, right? And it's important for us to know this. It's even more important. It's even more of a reason why you need to, detect early, right?
Yeah.
So that if you're going to be bearing such costs, then they don't break the bank. So thank you for that. All right. So let's talk about what to expect. If you've, after a couple of weeks of your child having a headache, or suddenly your child a bit shaky on their feet, or any of the symptoms you described, you come to the hospital. What can a parent and a child expect? What processes will they be taken through if they come to Korle Bu seeking help?
Okay, so once you come, you identify any of these factors, and then you come to the hospital. Definitely, you would be examined by a medical person, a doctor, to be precise. And then, based on the history, and then the symptoms, their progression, and what the current state of the child is either the child is admitted, depending on how you're presenting. Either the child is admitted, and then investigations such as the blood work, the chest x-ray, the abdominal scans, and then so if it is a tumor or it is a mass, samples of that, a sample of it is taken to the lab for pathological assessment to see the kind of cancer it is, how aggressive it is, and whether it has spread. So it all depends on how early or late you present. So some of the investigations can be done on outpatient basis. So if you come in a stable state, you have probably identified a symptom that has persisted, you're concerned, and then you come, you interact with the doctor, he takes a history, he examines the child, and then he requests for you to do some specific blood work. It could be an x-ray, it could be an ultrasound scan, it could be fluid from the child's back, which is known as a CSF, or we can also do a bone marrow, especially for the bone cancers, to see whether not just the bone cancers, any other cancer, because it can spread to the bone, it can spread to the brain, it can spread to any other part of the body. All those investigations would have to be done. Yeah.
So that's the typical process
That's
you
the
take.
typical
child
process.
through. Okay, and beyond that, then the decisions.
Exactly.
Decisions are
Exactly.
made.
Okay, all right. Listen, let's talk about prevention. Is it even possible? Is it possible to prevent your child from developing childhood cancers?
So that's a tough one. So because, like we mentioned, there isn't any specific cure, you can't necessarily prevent it in the sense that, if I do A, B, C, then my child will not have cancer. But you can do things that will help, give the child a better chance at not getting it. Of course, we always speak about ensuring that your child has a healthy environment. So the funny thing is that say 90% of the children who are living with cancer are living in low, middle, and income countries. So the socioeconomic status or the exposure that the child has can make them prone to developing cancer. So you're obviously going to, as a parent, try to give your child the best environment possible. You won't keep them from the world, but obviously good food, vegetables, fruits, exercise, so that even if they do have cancer, because if you have other comorbidities, so say a child has cancer and a child is severely malnourished, the chances of survival are lower. Or a child has cancer, a child has HIV. That's tough. So, obviously keep the child as healthy as possible. And then also, I would say that there are different levels of prevention. So let's say this primary prevention, for instance, doing ABC will stop cancer. That may not be necessarily possible, but giving them a healthy life generally, and then also getting to the hospital immediately you see something wrong, because that's also another level of prevention, of making the cancer go further. That should be the best way to help your child. Yeah.
Okay, so it's not exactly something you could set out preventive measures for, but you can reduce the chances.
You can reduce the chances, yeah, and you can
Okay.
also give the child a better chance if they have cancer to make it. Yeah.
So I
Very
want to find out how many of the children that you admit, how many of them go on to live, to survive it?
Because of the late presentation, say about 20%.
Wow.
Yeah.
Currently, only about 20% of the children who come into the hospital system survive it.
Yes.
And we heard a rather disturbing figure that there are you're getting about 250 cases
180 on the average
A year.
A year.
But mind you, there are about, based on the global estimates, there are about 1,200 children under 15 who have cancer a year. So if
In
we're
Ghana.
seeing,
In Ghana.
So if we're seeing about 180, and say Konfanochi is seeing close to that, that is less than half the cases that actually have cancer. And obviously, we are underestimating the people that have cancer.
Right.
So 20% of those that actually come for healthcare are surviving. So you can imagine, if you're talking about countrywide, maybe if you have to do the right extrapolation, you're seeing about 10%, 5%, because some of them are dying undiagnosed.
Yeah.
So
That's crazy.
And what are the common cases today?
on our ward, we'll say most of them are leukemias.
Leukemias and then the lymphomas.
Yeah.
And this low survival rate is completely down to late detection or late reporting.
Late presentation.
Late
So
presentation.
late presentation,
Misdiagnosis.
yes, and then also abandonment of treatment. So we actually have parents who start on treatment and then disappear.
Why? Is it the financial?
Yes, the cost. The
Wow.
medications are quite costly. And
The-
the investigations involved, they are quite expensive.
And then the mentality. So this country is plagued with people thinking that the herbal preparation, so you have a lump, for instance, and you hear people talking about herbal medication to melt the lump. So they are hearing things from other people, the people at home. They trust them more because somebody will come and say, oh, my child had a lump here. I applied this herbal preparation, it went. And obviously they'll take that over having to stay in the hospital for long periods. They are scared of the chemotherapy drugs. So what they don't know, I would say, kills them, because they think that other forms of treatment are better or will work. So
Listen, let's do people a favor today. Can we explain to them in simple language why a herbal concoction melting cancerous cells doesn't make sense?
So I'll say, for starters, basically, if you're drinking a herbal concoction, it's going into your stomach. It's coming out of your alimentary canal. So from mouth to anus, excuse my language,
No,
yes.
it's proper language.
So essentially
Anus.
that, yes. And so something that goes through your alimentary canal cannot reach a cancerous cell that's probably in your hand. Essentially, typically, because the anti-cancer medications are mostly intravenous, so they go through the venous system, the blood, and then reaches the other points in the body. So if someone is drinking a herbal preparation, it's unlikely that it will go and touch the cancerous cell there. Secondly, we don't know what these herbal preparations are made of. Most of them are causing kidney failure, they're causing liver failure, so they're only going to cause more harm than good. So basically, if you hear things like this, you need to ask yourself, is it something that makes sense? Yeah,
But cancerous cells, and melt. The two words. That's that.
Yeah, I
that's-
mean the cells are also like, I mean, there are cells that are overgrowing. They're doing their own thing. And it's not ice, for instance, that can melt. So I'm sure that's where you are going. Yeah, it's not ice. It cannot melt just like that. It's not something that like ice or butter that can be in a solid form and then melt. These are actual solid cells that can only be like, killed with specific medication. They cannot be melted. Yeah.
That's that. I wanted them to hear it from you. Media, they say I don't respect. So I wanted them to hear it from you. So you can't drink a herbal medication and expect it
melt,
to
yeah.
melt your cancerous cells.
No, you most certainly cannot.
Okay, all right. But this 20% survival rate, it is worrying. It's important that we know it though, because the causes are crucial. Abandonment of treatment and late presentation. Right?
But could you on the bit about the survival, if we were to report early, what difference would that have? Would that make to that figure of 20%?
So the 20% would rise to 75%. That would leave 25% of children dying anyway, because some of the cancers cannot be treated here. So these are some of the things. We don't have everything that we need in Ghana, the resources to treat some of the cancers. But if the common ones that present, if they came early, 75% of them would live.
So instead of 80% of them dying,
you'd have like
25%
25%,
would be at
which is
risk
still
of dying.
sad, but I mean,
It's much better than
That'll be
80.
improvement.
way better. That's about 3 times, the death rate when you present late.
Okay. Listen, we're going to take a break. When we come back, we'll open the phone lines because I have no doubt you've got questions for the two doctors. Okay. And I have one. We certainly want to know the cancers that can't be treated here in Ghana. Just before we open those lines, what are those cancers that can't be treated in Ghana?
So we have the acute myeloid leukemias.
Right.
So the issue with them is that with the treatments, the side effects are quite extensive. So you need proper ICU care, you need proper machines that can help a child pull through, and we don't have that in Ghana. So it's quite difficult to start treatments knowing that the side effects can kill the child before the treatment even
Is
progresses.
completed.
Yes.
Right. That makes sense. Okay. All right. Listen, let's take some calls. 0302 216 541 055 1111 997. Call us with your questions. We'll get you answers. Ben is already on the line from Kumasi. Ben, good morning.
Yeah, hello, good morning for you.
Yeah, thanks for calling, Ben.
Yeah, good morning.
Okay, what's your question?
Well, I don't really have any questions for now, but I think I want to make some little contribution about the preventive aspect of cancer. I think the doctors didn't really help us because I think current researchers are showing that a lot of the processed food that we consume contains a lot of carcinogens, okay, like the processed meat, the smoked fish, and all these things. So I would be happy if Joy FM could invite a nutritionist and a dietitian to come and talk to us through about the food that we consume, and especially the processed food that we consume, the noodles that the children are eating a lot these days, these vegetable oils and the preservatives that are put in them. I think that one will help us because current research shows that a lot of the cancers we are getting is basically out of the food that we are eating. So if Joy FM could do that for us and then take us through that nutritional aspect and the diet aspect, I think it will help us. Or even the doctors themselves can even come again on the preventive aspect as to the food that we eat that can make us have cancers, especially.
We'll actually get the doctors to respond to your contribution before they leave, so stay tuned. Martha is in Tema. Hi, Martha. Good morning.
Hi, Kojo. Good morning.
How are you?
I'm good, and you?
Not bad at all, Martha. Okay, what's your question?
Please, I would like to ask a bit of question with the doctors. Please, I have a 13-year-old boy. My concern is for some few days now, when he goes out to play after school, he comes back with the eyes very reddish. And then at night, then he sneezes continuously. I would like to ask if maybe I should be a bit worried about his health concerning the discussion being held right now.
So let me go over it. He comes back from play with very red
Yes.
eyes, and then at night
Very
he does
reddish,
what?
And then he starts to sneeze continuously.
Sneeze. Okay. All right, got it. We'll get you an answer, Martha. Don't worry.
Oh, thank you.
Okay. Let's take a few more calls. 0302 216541 055 1111 997. What are your questions for our guests? We're talking about childhood cancers. We've already learned so much, but you might have unique questions about your own situation that you want to get some clarity from the doctors on. So call us. This is your chance to do so. We'll take a few calls, get a few answers, and if there's time, we might take some more. Kate is on the line. Kate, where are you calling from?
I'm calling from Legon Hill. Who's Legon?
Fantastic. All right, what's your question?
My question is that my child has eczema. She's very, very itchy. This has been ongoing for, I think, about since she was born. She's 5 years now.
Now,
She's always itchy, yes.
how old is he now?
She's 5.
Okay, and he's been having eczema for how long?
Since she was a child, since she was a baby. Like,
Okay.
she was born with it.
Okay. And what's
And
your question?
She's always itchy. He always has this rash on his skin. We've seen dermatologists. We are always giving like steroid creams and then oral steroids for his as well.
Okay. So you want to know if you should be
Yes.
thinking about potential cancers?
Yes, please.
Okay, we'll get you an answer.
All right. Thank you.
Thank you, Kate. All right, Omusumuru is on the line. Hey, long time, Omusumuru. How are you?
Yes.
Okay, so what's your question?
Oh, I want to know about the herbal medicine she was talking about.
Mm-hmm.
Because I know in those days, those are the at least the easiest or the immediate medicine that our forefathers used, our grandfathers used.
Mm-hmm.
So is it that they have make a research or they have research and know that the herbal medicine is not good to cure cancer, or like some of them? Do we have some that can cure or can at least reduce the cancer, or it's no good at all?
Just to check though, are you saying that our forefathers cured cancer with herbal medicine?
Yes, we have some herbs that when you have cancer and then you take them, at least
Forefathers had
it can
cancer.
survive you.
Our forefathers had cancer and cured it with herbal medicine. That's what you're saying?
Like let's say breast cancer or some of the cancers. Yes, we have cancer in the mouth or cancer. Yes, some of them used, because in the olden days, hospitals were not many in the system, and they were using herbs to cure a lot of diseases. And cancer was one, because even though they didn't have a test to show that this is cancer, but sometimes you can see that there's a sore in the child's leg that is not, they've cured it for some time, it's not going. But there are some herbs that when you put it, when you grind it and put it on it, or when you drink it for some time, at least the sore or the wound will be cured.
We'll get you an answer, Omusumuru. Thank you. Thank you for calling. You can call us to 0302 216 541 055 1111 997. We've got about 4 contributions and questions to go with. Maybe we'll get answers to those and then we'll come back for a few more calls. So I don't know which of you will take which question first, but Ben in Kumasi had a comment. He said that he had hoped to hear more about the connection between the things we eat and cancer. So he was asking about the carcinogens that you find in processed foods and preservatives and so forth. Are they not also causing childhood cancers?
So I think we mentioned that there are no clear causes. So these carcinogens are postulated. So people have done their research, and it's not every. I would like to state that it's not every research that you find online that has that is substantiated or that has like backing. Okay, so we need to be careful about the things that we read online. But of course, I think we also mentioned that the fruits and the vegetables. So you're living a healthy life, which includes staying away from processed foods and going for fruits and vegetables that can help build your immunity. So yes, there's a concern about processed foods, but that goes with every other illness, not necessarily just cancer. It's okay to focus on the fruits and vegetables, the healthy foods from our backyard gardens, organic things. Yes, so I mean, I agree with him, but there's no clear link with processed foods and cancer. But obviously processed foods are not good for anybody. So yeah.
Okay. Martha in Tema was asking about her 13-year-old boy. Now, he comes back from play and he's got really bloodshot eyes, very red, and he sneezes throughout the night. Should she be worried?
Well, with the symptoms that she has just reported to us, I don't think she should be worried, because what this child might have are allergies. Yes, because when the child goes to play, where does a child go to play? Is it in a dusty environment? Is it in a grass? Is it anything that can cause allergies? And then sometimes, I mean, when they come, so if the child has an allergy, the child will keep rubbing the eyes, which will cause the eye to be red. I mean, we could also ask her if the child has any eye pain or if the child has any eye discharge. If there's an eye pain or the child has an eye discharge, it could be as a result of an infection. I mean, like a conjunctivitis, a bacterial infection, which you definitely have to go to the hospital for. But with the kind of symptoms that she's talking about, it sounds more like an allergic conjunctivitis. Yes, more than something should be concerned about cancer.
If it persists, should she still see her doctor?
Definitely.
Oh, I think even now
she should see the doctor.
Yeah,
Yes, because allergies are things that can be treated out and sorted out. So she also needs to find out what specifically the child is allergic to, because I mean, it's not just about taking medication and applying things to it. You need to find out the offending factor, because without taking that away, the symptoms will keep persisting. I mean, I don't know, I think it goes for Kate as well. She's saying that a child has eczema, which she's been treating with steroids. So that means that there's something that is causing the allergy, and then she hasn't found it. So until she takes that offending factor away, the child is going to continue to have these symptoms, and she's going to continue to use the steroid creams, but then she will not see, I mean, a result. I don't know if Daniela wants to add on.
Yeah, so it's just I mean, like, once there's an exposure with allergies, once there's an exposure to the allergen, to that which is causing the allergies, then you have very little control. So for parents who have children with eczema, we like to say they should keep an allergic diary. So sometimes you think it's just food, or it's just maybe what they're using to bath, but it goes all the way to the product that is used to wash their clothes, the perfume that you may use, the ointments or the creams that you may use on the regular. And even things like some of the clothes that they wear. Sometimes when you buy clothes for the children, they have to be washed. And for children that have eczema, it's usually non-bio detergent that you use, because the biologic agents can cause allergies. So those detergents and things have to be used to help the child, so that the contact with something that maybe the preservatives, even in the clothes, doesn't affect the child. So for both of them, I think for Martha, who has a 13-year-old, she should probably keep a diary, keep, noting down the things that seem to make the child sneeze more, make the child's eye red. And then for Kate as well, she should look at the things that she uses to wash the child's clothes, the things that the child eats, and then surrounding factors that will help them. Yeah.
Right. And finally, Omusumuru, he wanted some clarity on this whole thing with herbal medicines. As far as he's concerned, our forefathers relied on herbal medicines. So what are you saying when you say that these herbal medicines don't work. Our forefathers have been treating cancer with herbal medicines. That's Omusumuru's question.
Okay, so that's the big, I would say that's the big challenge in our society. So there's belief that, our forefathers used herbal medications to treat a number of things, but those times you can't say that maybe someone took this medication and then died afterwards. There's never any record of that. So I'll just tell Omusumuru that if he thinks that someone close to him, or if anybody thinks that someone close to them could have cancer, they should just come to the hospital. We'll take it from there. There's no need to take these herbal medications. And even, let me just say now, the herbal medications are plagued with pesticides and weedicides, which we mentioned before are chemicals that could predispose you to cancer. Those times, they were organic in your backyard. So they were even a little more safe. But right now, they are plagued with all sorts of chemicals. The soil is, infected with God knows what, the air is polluted. So if you think your child has cancer, if you think there's anything concerning about your child, an ulcer, a sore, please just come to the hospital. We're ready to help, and then we're ready to attend to the child.
Okay.
Thank you.
Now listen, Martha is back on the line, the mother of the 13-year-old who gets red eyes. I think she has a follow-up question for us. Martha, can you hear us?
Yes, please, Brakojo. Please, about where he goes out to play. There is this football park that most of the times the kids, when they come back from school, they go out to play there. The place is very airy. So from the first day, when he went there, then I noticed it. I told him because the air is too much for him, he shouldn't go. But just yesterday, when the thing started about a week now, we sent her to a pharmacy around our area. They said it's an anti-allergy. So he was given anti-allergy drug. So after taking it for just that few days, just yesterday when he came back and then he went to play again, he had the same thing again. So should that be a cause for me to get worried as a parent?
No, so Martha, thank you for your question, first of all. So as we mentioned, for allergies, the more a child is exposed to the allergen, the more the child will react. So for instance, let's say you eat something, it doesn't augur well with your body or your tummy. The more you eat it, the more your tummy will have a problem. Yes, so the most important thing is for him to avoid the allergen or to reduce it as much as possible, because in your case you mentioned he took some medication, it helped. So since he's still playing with the dust and the grass and all these things that could cause the allergies, then even though you take the medication, he's going back to the same thing that caused the issue. So that's where the problem is probably coming from. So your worry should be more dealing with the possible allergens, but I don't think you have anything to worry about when it comes to cancer.
Well, there you go, Martha. I hope you found that helpful. I've got to say, you guys have really helped us out with these
Could there's a
questions.
last question in here. Can any type of cancer be inherited genetically?
We don't mind who answers.
Okay, so I think we mentioned that there's a 5% genetic factor. So not necessarily inherited, but of course, once you're from the same family, some cancers are linked to, families. So for instance, if you have a family member who had for instance, let me use like breast cancer is very common. So you have maybe a mother who had breast cancer, then you are likely to have inherited some gene that could cause breast cancer. So in the same way with some cancers, you can have like a positive family history, which means someone in your family who has a cancer, and then you can also go on to have cancer. Yes, that's possible, but it's usually in 5% of the cases.
Right.